Yeah, good afternoon all and welcome. I, Sundeep Akula from NATCO team. You are listening to another special episode of Respire, one voice at a time. It's a joint initiative by NATCO and Voice of Healthcare. Respire, coming to Respire, a podcast series navigating the journey of lung health and oncology related aspects. You all know lung cancer is the most common and remains one of the leading causes for the cancer related deaths in India. And also, there are a lot of misconceptions, myths, and gaps to understand this. So it always falls under the shadows of the focus. So we need an expertise for this. So today we have the renowned medical oncologist, Dr. Chetna Bakshi, from Thane, from Jupiter Hospital, Thane. Over to you, ma'am. Thanks for accepting our invitation and giving your time and to clear the general doubts and myths and misconceptions there with lung cancer.
Hi, good afternoon.
Yeah. Shall we start, ma'am? Sandesh?
Yes, Sundeep.
Ma'am, once again, we'll go for a live. Just for
Yeah, okay. There was some problem in between.
yes, in between there is a problem. Sandesh.
Okay.
Sandesh,
We are like
take a pause of 7 seconds. Once again, we'll go for a live.
Sundeep, like now the session is live, we can't like end it. So please like carry on from here onwards.
Okay, because there was a disturbance actually in between. Okay, no issues.
But the thing is like otherwise we have to end it, then we have to reshare it. So like we have to create a new
So you
link
can
and
just
all of
start
the things.
asking the questions.
Yeah, you can start from here onwards.
Okay, so coming to this podcast series where we are discussing about lung cancer awareness. So to understand the burden, ma'am, why is lung cancer is so important and more common among non-smokers also? Anyways, we talked about smokers, but
Yeah. So no, basically, we see in last few years lung cancer is increasing in India, and now in men it is a second most common malignancy in India in men, and in females also we are seeing more and more lung cancer. So as you rightly said, yes, lung cancer is very common in smokers. However, nowadays, I mean, we see so much of pollution. So because of environmental pollution, because of occupational exposures and passive smoking, so there are so many causes because of which lung cancer is increasing, and so the genetic predisposition. Nowadays, we see more females also smoking. That's why lung cancer is increasing in females also.
okay. Females means which age group, ma'am? Generally, when you
So we generally see in middle-aged females, lung cancer is more. So there can be, as I said, occupational exposure, not much in females, but yes, smoking. Then passive smoking is one important cause. Then fumes because of the cooking gas. So these are all causes why we see lung cancer in females.
okay. So you're talking about the other risk factors related to lung cancer, not only the tobacco usage and smoking.
Yeah,
Right,
yeah.
ma'am?
So tobacco is the most important risk factor for lung cancer. There are multiple other risk factors, like as I said, occupational exposure. People who are working in asbestos industries, in leather industry, they are all more prone to get, because they inhale those fumes, so they are more prone to get lung cancer. And then passive smoking is also one of the important risk factors in young patients when we see. So there may be a family history, so in those patients also we see more lung cancers.
So coming to the screening and diagnosis part, ma'am, is it so important to detect early lung cancer, ma'am?
Yes, in fact, any cancer, especially lung cancer, when we detect early, if we are able to detect this cancer in stage 1 and 2, it is completely curable disease. So that is the reason why it is so important to detect early. In our OPD, when I'm sitting in this OPD, most of the patients, like almost 90% of the patients who I see, are in stage 3 and stage 4, where we cannot cure them completely. However, if we detect in stage 1 and 2, we can cure it completely. That's why early detection is important. Having said that, screening, you asked about screening. There is no national screening program in India as such for lung cancer, because for mass it is very expensive. We require to do low dose CT scans, which is not possible in India. So we are not doing a routine screening for lung cancer, which is done in countries like US and Australia. However, I advise that if some person is a chronic chain smoker, then he's at a higher risk. So when he's doing his, ideally he should do his yearly checkup. And when he's doing his yearly checkup and he's symptomatic, he should get his low dose CT scan done.
Ma'am, you already
In
answered my
India,
next
there is
question
no
actually.
national screening program. Acha, okay.
So I was about to ask about this low dose CT, which is how far it is accessible for, because you are the person who see from the different parts of tier 2 and tier 3 cities. So how far
Yeah, yeah.
is this accessible, ma'am?
No, so
This
we do
low
not.
dose
No.
CT?
No. We do not see. No, it is only seen in the cities which are, Mumbai and Bangalore. Otherwise, low dose CT scan is not there in tier 2 cities. And in my view, as I
Mm,
said, there is no screening as such for the lung cancer. It's okay. But I think what is required is a high index of suspicion. So in patients
mm,
who are at high risk, whenever he goes to even a general physician or a chest physician, they should have a high index of suspicion for such patients who are symptomatic. Then one should definitely immediately start evaluating for the cancer in them.
okay, ma'am. And what kind of signs and symptoms should never be ignored by the patient once it has
Yeah. So if it is a high risk, then any cough more than 15 days, or if patient has got even once hemoptysis, that is blood in the sputum. Then if he becomes breathless, if there is a breathlessness after walking, say 100 meters or 200 meters, if he becomes breathless, then these are the symptoms for lung cancer for all the patients. If he is high risk, then even for 10 days of symptoms, he should definitely immediately go to the doctor. But otherwise, we always advise that any cough which is for 15 days, not responding to general antibiotics, if he's having hemoptysis, if he's having breathlessness, weight loss, loss of appetite. So all these things are symptoms of lung cancer, and patient should immediately go to the hospital. And see, there is no need to go to oncologist immediately, because all patients, so we do understand it is not easy for a patient to just walk into an oncologist and say ki dekho mujhe cancer hai kya. But what is
been.
important is to reach out to at least a physician nearby. Whoever is your family doctor, your physician whom you're always going, you should reach out to him and you should talk to him and tell them your concerns. Then they will investigate, and only if required, you have to go to an oncologist. That is how it should be.
Okay. Okay. Anyways, ma'am, coming to the treatment, if you see the treatment landscape, because you've been expertise in treating more than 2 decades, I hope. So, what kind of evolution has been changed, ma'am, from treating lung cancer?
So, in fact, the most advancement is seen in lung cancer, and we are amazed. So, 20 years back when I started my practice, whenever we used to see lung cancer patients, we never had any answer to give them, because, as I told you, most of the patients are stage 3, stage 4. We didn't have anything much to offer, and we used to tell them अच्छे 8 महीने रहेगा and all those things. Since then we have come so long way. Now we have got targeted therapies, immunotherapies, and they are most successful in lung cancer only. So now we see patients in patients, if there is a target, there are multiple targets in lung cancer like EGFR, ALK, ROS/MET. So if these targets are positive, like in around 30 to 35% of the patients, or maybe more than that, we get some kind of target positive. So we can give them targeted treatment, which is mostly in the form of pills. It is not a chemotherapy which will have a blanket effect. Chemotherapy has a blanket effect. That's why patient comes with a lot of side effects. Targeted therapy is in the form of tablets. It is very easily taken. There are not much side effects. It will just go and target your tumor. So that way, and patient responds in a better way if target is present. So this is one. So where we used to talk about 6 8 months, now we talk about years, for the patient, even those patients who are stage 4 disease. And now immunotherapy has come. So how immunotherapy helps is, when we give immunotherapy, it will make your own T cells fight against the cancer. So even immunotherapy is a good form of treatment. It is easy, less side effects, and patients respond very well to these therapies, especially in lung cancers. Because of these newer treatments, quality of life is better, and they survive for the longer period, sometimes in years, 5 7 years. I have 2 3 patients of lung cancer who were stage 4 with brain metastasis when they came to me in 2018 19, and now they are still coming and they are in such a good shape. So there's a lot of evolution has happened.
Okay. Okay. And when these many, meant to say, this much evolution has been happened, or also different types of options of treatment has been evolved. So, is there any personalized treatment plans,
Yes.
ma'am, for
Yeah, so when we talk about these targeted and immunotherapy, they are personalized only. Like what we
okay.
do is, when patient comes, we take their block and we send for NGS, and we get the reports. As per the reports, we personalize, tailor-made the treatment and give those treatment to the patient. So this is what we do. And in fact, in so there are lung cancer vaccines are also now coming, which is obviously not commercially available. Phase 1, phase 2 trials going on. So once we get those trials, then that will be trials and vaccines, it will be all the more good, where we can just take a part of tumor, and with the help of new antigens, if we give to the patient, that will be really nice.
Okay, ma'am. Coming to that one point which always strikes in Indian economy is that affordability, ma'am. So, how often, mean to say, how far this
Yeah.
targeted and in this immunotherapy is affordable to the patient?
So yes. Yes, so targeted therapy, so we have different targets, and the most common target is EGFR. So for which we do have treatment which is affordable, because generics have come. So basically, why we find these treatments unaffordable, because they are patented medicines and they are
Hmm.
imported to India. Once their patent is over, most of our Indian companies are able to make these products. They form biosimilars. They make so many biosimilars, which makes them a lot of, which makes them affordable. So we keep on waiting when the patent is getting over. Now for immunotherapies, I think by next June or so, we'll start getting generics, and then it will become affordable. Now also it is not that unaffordable, but yes, it is expensive.
So, when we talk about this accessibility and affordability, ma'am, as per your expertise, what are the major barriers to for assessing this quality cancer care in India? What What are the major
So
barriers you saw?
major barrier. So first thing is now unavailability of oncologists
Yes.
all over. So because we have oncologists mainly in the tier 1 cities. Nowadays we have a lot of good doctors in tier 2 cities also. But in many of the villages they do not have doctors. So they have to travel to Mumbai or places like that, Pune, or places, bigger places. So that is one thing which is a major hurdle for the families. Secondly, and because of that also, they are not able to get diagnosed early. So this is the first hurdle. Second hurdle is, in India now, most of them, they do not have mediclaim. So people have health is out of pocket expense, and it is always, it comes last. People don't want to spend on health. That is second hurdle which is there. And then treatment is expensive. Sometimes people are ready to travel to bigger cities, however they have to stay there, which becomes difficult. Like they can travel, take treatment and go back. However, treatment is longer, sometimes 6 months, sometimes 1 year. It takes time. So it is difficult for people to stay there. So that is again, there is a problem. And in India, most of the families, they have only one earning member. So unfortunately, the earning member gets this disease, then it becomes a very big problem for the family. They are not able to go ahead with the treatment. So there are multiple problems which we see in India. However, I must say that in like since my short tenure of 20 years, I'm seeing so much of a change. People are changing, treatments are changing, they want to take treatment. They are, they are more aware. Even so, even patients who are less educated, they go through all the internet, all they read up, they come, they agree, and they try to understand, which is good.
Okay. And what kind of public and private partnership play in this settings, ma'am, for accessibility?
So in India, we do not have, I mean, I don't think so. We have this kind of public private partnership. However, if it is there, it will be very nice. And I'm not aware, I'm not sure, but I think government of Maharashtra is coming up with such kind of partnership where,
Yes.
they will have an hospital where it will be run by the private institute, and there will be some 50% of the beds for public, which will be really nice. It helps in the
Yes.
sense, they can channel the funds properly, so that way it will be really helpful. But and they are thinking, I'm sure, I've heard that government of Maharashtra is doing something for it. They are very actively thinking about it, so I'm hoping that by next year we'll have some such kind of partnership hospital in Thane, where I'm practicing.
Okay. It would be nice to hear, ma'am, from Maharashtra if it is that happens. And also, ma'am, you talked about the
Yes,
symptoms, you
yes.
talked about the diagnosis, you talked about the treatment evaluation, everything. But still, the cancer word itself is not only affects the person but entire family.
Taboo.
So, what
It's a
kind
taboo.
of yeah? So, what kind of social impact will be there on mental health, or
So,
what
so
kind of
actually
support is
this only
generally?
requires awareness. No,
Yes.
no. So this only requires awareness. Cancer is like any other disease. So I always ask my patients, you also have diabetes. You never cried when you were diagnosed as diabetes. You also have heart
Yes.
disease. You never cried. Why are you crying when you are talking about cancer? It is not. It is just like any other disease. And if it is diagnosed early, it can be treated like any other disease, right? So there is a taboo because I mean many people, they do not tell any other person that somebody in my family has cancer, because people feel that it is genetic and it will be transferred, or some people think it is infectious. However, what we need is more public awareness campaign like what you are doing now. So we need more public awareness, more talking about cancer, then only that stigma will go down slowly. So this should be done by majorly, by nurses, by doctors, by general physicians. So everybody has to contribute in it. And whenever I take awareness talk, I always tell the general public that if you have heard me, you should go and tell five more people. So that is how it will spread word of mouth, and tell everyone that cancer is just a disease like any other disease. Okay, people are also afraid about the side effects of chemotherapy and all, but now even all those things are also changing. We have got such a good supportive care available. Newer chemotherapeutic drugs are easier to take. So many things are, changing in cancer treatment, cancer diagnosis. So but awareness is what is required, and that I think you are doing it.
Yes. So that is what, ma'am, the main what this platform is all about, this podcast series.
Right,
And also, ma'am,
right.
you as you rightly said, everyone should be contribute for this. But what kind of a role will be there with caregivers, ma'am, to give this mental support?
In fact, caregivers are the first ones
Yes,
to
ma'am.
give all this kind of support to the family members. So even, we should. So when as a doctor, when I'm seeing a patient, my job is to talk to caregiver also, because many times caregiver, there is a burnout of caregivers also, because
Mhm.
cancer is it's a long treatment, right? And after some time, even caregivers gets burnout. So it is important for one person to have two or three people to look after one alternatingly. Then, to explain them, secondly to explain them that it is not infectious, that you are taking care of this person, that doesn't mean that you are going to get this disease. So all these things are required. But at the same time, when we are fighting with the cancer as a disease, it is always, the three, it should be three pronged. One is doctor, one is patient, and one is caregiver. When all three of them together they fight, then only we can win the disease.
So nicely explained, ma'am. So nicely. And coming to uh, what kind of advice, ma'am, for example, a person who's coming from tier 2 or tier 3 city, who's afraid of, meant to say, financially background is very low. So what kind of advice you give to those type of patients?
So see, finances. I mean, if financially somebody is from low economic strata, there are multiple government schemes available. Like we have this Ayushman Yojana, and many hospitals have this Ayushman Yojana, but people do not know about it. So we try to
Mm.
enlighten them that these are the hospitals where you can go, and you can go to Tata Hospital, which is a ACE institute, right? Where it is not that expensive. They can go to hospitals like KEM, where they give good treatments. Then there are multiple schemes by there are some Prime Minister Yojana, CM Yojana, through which, if you apply to them, they give money to these patients. Even in TMC, BMC, if a lady who's having cervical cancer, breast cancer, if they apply, they get some kind of money. So there are multiple schemes available. However, many people do not know about it. So I think from government
Mm.
side also, they should advertise more about these schemes, so that if people know that there are some such kind of schemes, so even they do not have money, they should be able to take the treatment.
For example, ma'am, general package, entire package will be covered in this, or 70 to 80% will be covered in this for
So they give a fixed amount. I don't know the pack. I don't think so. They give
general.
some percentage of the package. But as I
Mm.
said, ki nowadays generic targeted therapies are also available. So most of them are completely covered under it, and patient do not require admission. So there are no admission required. So no hospital costs are there. So that it depends upon what kind of cancer, what kind of reports you come with. That will only tell us how much it will be helpful for you.
Yeah, because this is the first question you always see whenever the patient comes. Ma'am, पूरा cover हो सकता
Yes,
है
yes,
इसमें
yes,
क्या
right.
क्या? Generally, so that is the reason I have
Yeah,
asked
so
this
there
one.
are different.
And
So people who are taking health insurance, they should be very much aware of it when they sign over it. They should be aware and read it, that whatever cancer I get, it should be covered, because many times there are something written and they'll come and show us कि cancer तो covered है, लेकिन cancer का ये वाला treatment cover नहीं है. So I think
mm,
whoever is signing, so it is the onus is on the patients and the health insurance companies. They should read it properly and they should be explained properly.
okay.
But there are
Anyways, when
multiple
you,
good government schemes that I can tell
yes,
you.
yeah, both private sector and government, both state as well as central.
Yes, yes, both
Okay, ma'am.
state as well as central.
Yeah. Anyways, I think one kind of myth or misconception is always there with the cancer patient. What you heard more? One misconception or one myth. मतलब ये होने
That
से
it
ये
is
हो सकता है
infectious.
वो.
That it
Oh,
is
cancer is.
infectious. This I have heard, which is totally
Okay.
wrong. It is not
Okay.
infectious at all. So many times even husbands or wives of the patients will come to me, इसको हो गया है, मैं इसके साथ में रह सकती हूँ क्या, मुझे हो जाएगा क्या, तो these are, या फिर हमारे बच्चों को होएगा क्या, तो these are the common misconception, which I would say is not right.
Ma'am, many ways you are very confident and discuss about the treatment option, but still in a common person mind, there will be a doubt. What gives him hope or you the hope to treat this lung cancer patient? Clinical practice, especially when you are
So
treating late stage.
yeah, so
What kind
whenever
of
I'm treating, I tell them the same. So there is constant evolution going on in oncology. As I told you in last 20 years, what has happened. So I always tell them कि आज मैं आपको बता रही हूँ कि maybe I am not able to cure you. I am just giving you this treatment to prolong the life. However, we do not know next year a treatment will come which will cure you. So you have to live for next 1 year at least. So get that treatment. So that's how I explain them.
so connecting to this, ma'am, one last powerful message for all for common audience and those who are listening here today. So one powerful message
So
for this.
okay. So one message is very common, which is stop smoking, which really
Yes.
reduces your risk. Second is early action will save your life. So whenever you are symptomatic, please don't ignore your symptoms. Go to your doctor. If you are afraid of oncologist, please go to a normal doctor, a physician, a general physician, your family doctor. But don't like keep it to yourself.
Thank you, ma'am. Thank you. Thank you, ma'am. Thanks for your valuable time once again, sharing your into say the valuable inputs on this lung cancer and also clearing the
Thank you.
misconceptions and giving confidence to the general audience. So lung cancer can be treatable. Thank you, ma'am, and also curable.
In early stage.
Thank you, ma'am.
Yes, in early stage. Yes. Thank you so
Thank you, ma'am.
much.
Sandesh, can you end the conversation?